Well, a new United Nations report says that investing in the education and well-being of 10-year-old girls could pay huge dividends for societies worldwide. The State of World Population report finds more than half of the world's 65 million 10-year-old girls live in the 48 countries with the worst gender inequality. Many of the world's 10-year-old girls live in sub-Saharan Africa, and the report says these girls are less likely than boys to get an education, and many are subject to forced marriage, child labor, and female genital mutilation. The UN report that reports that developing countries that allowed their girls to complete their secondary education could see an economic dividend amounting to billions of dollars every year.
To meet the health needs of rural indigents of Bayan Dutse in Akwanga, Nasarawa State, a non-governmental organization is teaming up with young doctors. Well, Channels Television's correspondent Halimatu Abubakar has that story.
Unlike in urban areas, healthcare delivery in rural areas is characterized by few healthcare centers and healthcare providers. That's the case in Bayan Dutse, in Akwanga local government area of Nasarawa State. It's no surprise that residents turn up in large numbers to take advantage of free medical services being provided by members of the National Youth Service Corps, in partnership with a non-governmental organization.
Some people do not have access to all these health facilities, so bringing it to their community, bringing it at their very doorstep is actually a very wonderful step, because they tend to gain a whole lot of things from here. Most of them, they do not have the wherewithal to move to the hospitals, but when we come here, there are the doctors, there are the pharmacists, there are the med lab scientists, there are the nutritionists, so they have what is obtainable in a hospital setting.
For patients in remote communities like these with limited access to quality health care, this is a welcome development. The medical team administers drugs and treatments for various illnesses and express their desire to do more, given adequate support.
For this to be more effective, I think there should be more collaboration, and there should be more sensitivity for people to volunteer. For example, now we have more, the people who are volunteering more are the coppers and probably some of the community dwellers. And so we need more volunteers and to be able to cater for the patients, because there are so much and it's kind of overwhelming.
Those behind the initiative intend to extend their reach to other parts of the state with the sole aim of improving the quality of life of rural dwellers.
Well, and that's our show for today. And I'll be sure to watch Africa 54 at voaafrica.com. You can find all our shows there and get up to the minute updates on all the world's top news stories. I'm Vincent McCory in Washington.
We look forward to bringing you another show next week. Check out our website. It's channelstv.com for all our local news and program information any day or night. I'm Chamberlain Usor. So long, everybody.
This is Channels Television, celebrating 21 years of professional broadcasting.
A very good evening to you. Thank you for joining us. Welcome to Sports Tonight. This is the Monday night edition of the show. It's the first edition of Sports Tonight for the week, and it promises to be exciting, fun-filled as always. I'm sure you've been waiting for this time. Of course, we will, on the program tonight, be reviewing some of the major events as they happened over the weekend, and we will also tonight be previewing some of the things that we'll be looking forward to seeing happen this week. My name is Tony Bitoye. I'd like to start the show off by saying thank you to you for joining us, and also leave you with this promise that if you stay with us for the next 50 minutes, that will be bringing Sports Tonight to you this Monday. We'll make it worth your while. We'll take you on the trip everywhere from